Hi, Dr. Martin Rutherford, Clinic Director of Power Health, author of Power Health Back to Basics, and Certified Functional Medicine Practitioner. And today we're going to start off in a relatively new path. We've been thinking about what types of subjects can we bring to the public that would be interesting. And for those of you who are followers of ours and familiar with the fact that we are in the process of putting out a functional medicine back to basics series as to how functional medicine is taught, how it should be performed, the types of aspects of care that are fundamental to a true functional medicine approach to these chronic conditions. We thought it would be interesting and illuminative to maybe within the framework of that start to present some case studies. It's very common, or it's very accepted in courses where you are going to learn these types of procedures if you're a physician of some sort, that as the details of functional medicine, as the basics of functional medicine, the chemistry of functional medicine is being taught, for the professor, for the doctor who's teaching the course to present a case study. And of course they're always there to emphasize one particular aspect of one particular thing that the teacher is presenting. However, with the types of things that we treat with the chronic fatigue syndrome and the fibromyalgia and the peripheral neuropathy and dizziness, vertigo, balance, irritable bowel, these are not one-trick ponies. These are complex situations. They are complex conditions with multiple contributing vicious cycles, multiple endocrine contributions, and they can be made sense of, and that's what we're trying to help you to do here. So we thought we would do more of a case study series for the lay community, and for those of you who are not lay people and are medical doctors or chiropractors or physical therapists or whoever are interested in this, I think you'll find a great deal of benefit in these case studies, and we'll welcome your feedback on that to find out if we're correct or not. So I'm going to start off with a case study, and that's going to be maybe a teeny bit longer than the ones that we'll be presenting in the future, but I picked this one for a couple of reasons. One, you'll find out when I get to the end. But the other reason, I'm familiar with the case, even though it was from a while ago. And it was a case that kind of embodied so many of the different aspects of abnormal physiology that contribute to chronic pain and chronic conditions. So I'm going to start off with this case study. The chief complaints were complaints of the kind of what they're calling today the mysterious metabolic disorders, the mystery diseases. The patient that comes in and has all of the symptoms has symptoms of so many different systems going wrong that the doctor's eyes kind of glaze over, and the rheumatologist is thinking, wow, that's neurological, and the neurologist is thinking that's an internist, and the internist is thinking, what are you doing here? And that's what's happening today. We're getting these multi-systems diseases, and so this case presented that way. It was an interesting case. It presented to the doctor with a 49-year-old male who had been under an enormous amount of stress, and then through an incident of allowing himself to be in a position that the gentleman was skiing. He was skiing all day. He was soaking wet, and instead of like just going to his car and going home, he sat there having a bite to eat, and opened up his jacket and was soaking wet, and the air apparently caused him to create a situation in which he developed pneumonia on top of being severely stressed. Over the next several weeks, next several days, the pneumonia increased severely, and and antibiotics were necessary to make sure that that person didn't die. Frankly, he couldn't breathe, and he ceded to medications. He was someone who was trying to not take medications, which isn't always a good idea, as he found out. And that kind of saved his life, but it never really. But then what happened was, as I hear so many times in so many other cases, I got in an accident, I had a baby, I went through a big stress, I had an overwhelming infection. This person had a big stress and an overwhelming infection. Everything went south. My life fell apart, is what people will tell me. And so happened to this gentleman. He started to get joint pains. His hair started to thin. His eyebrows started to thin. He put on weight. In retrospect, he put on about 25 pounds over a period of the next 3 months, at a time when he was out of work for almost a month of that time, laying on the couch, profuse sweating, chills, unable to eat, living on chicken soup, and putting on 25 pounds. These are all clinical pearls as to what is probably going on in this case. During that period of time, there was massive fatigue. This was a gentleman who had remained pretty athletic throughout his years, and suddenly 5 minutes on a treadmill would crash this gentleman for a couple of days. There was a lot of angst there, a lot of confusion, depression. A little bit of depression started to set in. There was anxiety. The person had a practice, was a physician, had a practice. There was a lot of anxiety in not being able to go to work, the practice being disrupted. And so there was stress. The person had already had some gut problems, which we're going to talk about in a few minutes, and these gut problems got much worse. So the diagnosis at the time, so this was the situation in which the person came in. Swollen ankles, heart palpitations, anxiety developed. The person never had a little bit of what he called kind of sports anxiety, where he would get nervous before he would play a game. But now that turned into kind of like full-blown anxiety, migrating, joint pains. This all happened within about 3 months of the time that the pneumonia took place, and that was layered over that person going through a chronic daily stress at that point in time. So those were the symptoms, and so in taking the history, so if you go back to the functional medicine, back to basics series that we're putting on, you'll understand how important the history is. And to go back in this gentleman's history, there are so many points of understanding of where to go with this case. And when we do a history, we generally have people write their history out as I'm about to present it to you. And that's knowing that person's history from birth. There's more there than I want to go over with here. I don't want to go so long that I bore you with this stuff. So I'm going to hit the high points. 5 weeks after this person was born, they had a surgery on their gut. It was something called a pyloric stenosis. There was no opening between the stomach and the intestines, so they had a surgery at that point in time. What we now know in the functional world, and it's in the literature, is that once you do a surgery of that nature, the person has, for all intents and purposes, a permanent leaky gut. There was nothing known about leaky gut back in the time that this occurred, which was in the 50s. So that was important to know. Then the young man was stressed, had a stressful environment that he grew up in, and in 3rd, 4th grade, he was given passes to go to the bathroom whenever he needed to, because he was chronically having to go to the bathroom to vomit. A lot of thoughts on that being psychological, but what we now know is when a young person starts to have those types of conditions, everything is checked, there's no pathology. You're probably looking at somebody who's already in some sort of an emotionally traumatic situation, and this carries forward because these emotional traumas tend to program themselves in something called the amygdala in your brain. So that was a good piece of pearls to put on the side. the young man developed ulcers when he was 15 and 16. So 15 and 16, he was into high school. He was in a stressful situation there. It was a very difficult high school and at a very difficult time, and there was a lot of tension in the high school, and played sports, was good in academics, kind of a perfectionist. Didn't like it when he didn't get good grades. Didn't like it if he had a bad game, if he played baseball or soccer. So there's a lot of stress there. So we're getting the stress idea. Then there was a concussion. There was a traumatic brain concussion. I'm gonna in 11th grade, and it was a concussion which in retrospect the gentleman began to realize that it started to change the course of his life a little bit. Not so much personality-wise, but it realized that he started to lose his math skills at that point in time. He was quite good in certain math skills, and then suddenly he was okay in them, enough to pass, but having the struggle. This is a salient point because right now a lot of chronic pain is starting to be looked at in light of brain function, and PTSD, emotional trauma, and traumatic brain injuries are starting to come into play significantly years later in these chronic issues, and certainly that's a part of this case. He went to school. He had a more severe traumatic brain injury playing soccer, kicked in the head, knocked out 20-25 minutes, and literally had to change his he had to change his major, which was at that time it was chemical engineering, and he had to take 6 months off of school, and he had migraines, and he had short-term memory loss, and he had moments of amnesia, and so pretty significant trauma there, to the degree where when he went back to school, he could no longer do engineering. He couldn't do the math calculations. He couldn't use the slide rules that they were using back then before computers, and that was pretty dramatic. Some people would say there's some personality changes there, but in the end, the gentleman had to change a major and go into another major that had nothing to do with math or engineering, so that he could salvage his bachelor's degree, which was a big thing to this young man. So that's stress, but I'm emphasizing the brain trauma. Then the gentleman went back in the sciences, and at that time, well, I'll take that back a little bit. So he before he left college again, a year later, he contracted mono, and mono is supposed to. Now we know it's a virus. We now know it's caused by Epstein-Barr virus. Mononucleosis is it's a real deal, and it makes you sick, and you get swollen glands, and you sweat, and you do that whole thing. But that's only supposed to last for like 4 to 6 weeks or less. For this gentleman, it lasted for 14 months, and at that point, there was a lot of angst. A lot of doctors, nobody knew what was wrong with him. He lost 25 or 35 pounds, so it was very thin. And then once he got out of that, it was about a year before he was able to participate in athletics again. So even though he graduated from school, he was still athletically involved in the world, but he had to take a whole year off because he couldn't run without fatiguing. So at this point, this gentleman's starting to develop chronic fatigue, or maybe not chronic fatigue at that point, but he starts having trouble with having to sleep more, and he starts having to manage his weight. Now, this is a person who was at those points in his time was playing sports and frequently would be working out for like 2-3 hours a day, and so the energy deficits were pretty obvious. So these are important milestones. I mean, from there on, I could go through a lot of different things, but those are the salient points, as you'll see, that we would take off of his, that we would take from him. He had a history through his 20s of not taking very good care of himself, not eating too well, maybe drinking more than he should have. There was definitely other physiological things that came up, but they aren't really things that really add at this point in time to where we're going to go with this case. So I would say that's up until he's like in his late 40s or maybe even 50 and thinking about it. It's just a matter of battling. It's a matter of battling gut problems. It's a matter of battling stress. It's a matter of battling more gut problems. And life's daily stresses and some other big stresses, and so that would exacerbate things. It was easy for me. It was easy for him to get lung infections. So once a year, it would seem like he would get a lung infection, be down, panic because he didn't know what was going on because it would always take weeks to go away. Anyway, so then we get up to the part where we talked about, where he's 49 or 50 years old. He gets set off. Now he has all of these symptoms, and nobody knows what's going on with him. So he lives here in Reno, Nevada, and I am sure that most of you out there don't know that Reno, Nevada was like one of the meccas of alternative healthcare back in the 70s and 80s, because the laws here were very free. We had divorce, and we had gambling, and we had legal, prostitution. So why not have alternative medicine, right? So we had medical doctors here who were doing Lasix for cancer before anybody ever. Laetrile for cancer long before anybody was ever doing that anywhere else. There were medical doctors here who were colleagues of mine that were seeing people from all over the world. The Philippines, you'd go in their offices. So this gentleman had this access here in Reno to these gentlemen. It was kind of like the wild west of what's happening to these folks. There's a gentleman not too far from here where I'm sitting, who was the one who discovered Epstein-Barr virus was causing mono, and that he brought that over to the fact that he thought it was causing chronic fatigue. The alternative medical world of Lyme, even though we're here on the West Coast, the alternative medical world of it's all metals, of chelations, a lot of it was just heavily present there. So this gentleman took access to those, went to several of those doctors. First thing he did was he went to his medical doctor, who was a friend of his, and the medical doctor told him he was depressed. And he said, "I'm not depressed." He said, "I'm sick." And he said, "No, you're depressed," and gave him a depression sheet and gave him antidepressants, which didn't work out very well for this gentleman. And so he tried the alternative medical field, and there was a sincere effort, in that person's opinion, to really try to help him. It went everything from bags and bags and bags of supplements that made his skin peel off of his face and made his gut worse, to a lot of different varieties of muscle testing. And I think there's something called a Vol machine where they took an electrical probe and put it on the finger and said, "You have Lyme disease." Actually, he was not determined to have Lyme disease, but they told him he had a number of different things. So without getting into the details of all this was the journey that we so frequently hear here. I went to the medical profession. They couldn't find anything. All the tests were normal, and then took the medications. The medications didn't do anything. Went to the alternative healthcare field. There was a lot of different theories going on at that point in time, and they were trying them all. This gentleman took the mercury out of his mouth to see if that would help. He got worse. We now know why that was. There are people who take mercury out of the mouth and get better. We know why that is now, and that's something we can talk about in the future. So he went through that whole gambit and was really not getting any better. Had good days, bad days. Had good weeks, bad weeks. It wasn't getting a whole lot worse because he was in the healthcare field and he kind of understood how to pace himself, so eventually he came to read an article from someone who was doing functional neurology. Now, I don't know how much functional neurology is really out there, like as much as functional medicine, but functional neurology you should learn about, because it is all this chronic pain issue. I mark my words, I've been talking about this for 10 or 11 or 12 or 13 years, I don't know how many years, that I really think it's the brain that starts these things. If you remember this gentleman's history, he had a history of significant emotional trauma when he was young, the vomiting and those types of things, and severe brain traumas. And that really never were thought of at all or talked about at all in any of the places where this gentleman went. So he read an article on chronic stress and fibromyalgia, and he had a suspicion that he had this thing called fibromyalgia, even though there's no such thing as a pain in the muscle fiber type of the disease. Fibromyalgia is a term we still use because it has meaning to people, and it has special meaning to those of us who are practicing functional neurology and functional medicine. So he read this article, and it made sense to him because one he understood was if you're in a chronic fight-flight response, you're in chronic stress, you had emotional trauma, it wouldn't go away. And this gentleman by this time had gone back into the sciences, and he had a background in the sciences and chemistry and biochemistry and anatomy. So he was able to understand what this article said, and it made sense. And they were talking about how the stress hormones, when they keep going, you're in chronic fight-flight, it affects your gut, it shuts down your gut, it shuts down your stomach, it gives you stomach problems, it presages ulcers, and women it causes cystitis and urinary tract infections. Chronic stress hormones can contribute to anxiety, panic attacks, depression, chronic sinus infections, chronic lung infections. I could go on. Tight neck, where you have to go to a chiropractor or a physical therapist and work on your neck. And ultimately, they also talked about how that condition could contribute to your brain being so overwhelmed by having a stress response that it overwhelms the response that blocks out pain. This is called the central pain syndrome. You can look up on powerhealthnet.com, on powerhealthtalk.com. You can look that up we have a whole presentation there on central pain syndromes. And that's what he was talking about. And then that could cause the sensitivity that gentleman was experiencing, to where some days it was really sensitive just to put on a shirt, and then other days it wasn't. So this gentleman accessed that gentleman, and that gentleman was a functional neurologist out of Appleton, Wisconsin, Dr. Johnson, you know I'm talking about, and started to learn from him, and started to do the functional brain rehab exercises, neuroplasticity exercises that we utilize here, and that are now well known. You can look up neuroplasticity exercises on powerhealthtalk.com or anywhere for that matter right now. And he started to get better. He started to get better. His brain started to get better. When his brain started to get better, different other aspects of his gut started to get better, and his pain started to go down a little bit. The main thing was the downward progress that patient was experiencing stopped, and it reversed to a certain degree. That gentleman had multiple sclerosis. The doctor the doctor who was the functional neurologist, and he turned this young man on to another doctor who was developing the concept of functional medicine, and he was developing it around the idea of Hashimoto's thyroiditis that has now exploded way past that, and autoimmunity, and this is a while ago. And so there was this concept that we're developing a lot of autoimmunity, and now Hashimoto's was actually causing most thyroid problems, and that it in of itself was one of the keys, in addition to this chronic stress response, that was contributing to chronic conditions. Well, Hashimoto's in and of itself, it can cause you to be depressed, put on weight, give you anxiety, panic attacks, insomnia, inward tremors, night sweats, and all the classic hypothyroid functions that this gentleman was experiencing. Missing hair, the outer third of the eyebrows gone, unexpected weight loss while you're living on chicken soup, inability to let go, to get rid of the weight loss no matter what you do, swollen ankles that he suddenly had developed, varicose veins he had suddenly developed. So this gentleman started to become a functional medicine practitioner, and so at that point started attending functional medicine types of methodology. And at that point, that is when testing was introduced. Now, if I'm doing a case study and your doctors out there, obviously, you know, I would be presenting this in a little bit more organized fashion. I would go over all of the testing. I'm not going to go over all of the testing, but I will say this. Once the functional, and this is congruent with our Back to Basics Functional Medicine series, once this patient had gotten to these two doctors, he had been completely evaluated neurologically. He had a general systems exam done. He filled out what at the time was, I think, a 35-page history, and all of it was very relevant. And then that all led to lab testing. And the lab testing came out to say this. The lab testing came out to say that this person had reactive hypoglycemia. What that means is no matter how you do it, no matter how you try to keep your blood sugar up, it's difficult. When your blood sugar drops, it's bad. If you're already compromised, you get low blood sugar, you get irritable, you get shaky, you want to choke people, you know, and if you're already compromised, it can cause anxiety, panic attacks, and these are the types of things this gentleman was having. His C-reactive protein was 6.40, just meeting, and it's almost 16, was 16.5, double what we think it should be. Ton of inflammation. Inflammation in the brain, inflammation in the arteries, heart attack waiting to happen, because he also had high cholesterol at that point in time. Decreased blood cells showing anemia, so the gentleman had anemia. If you look at we're doing a series on also how to take that stuff from the Back to Basics series on how to evaluate a patient and how to treat them. And anemia is kind of, if a person doesn't have enough oxygen in their system, they're not getting better of anything. Well, if you don't have enough anemia, you don't have enough oxygen to your brain, to your extremities, to your gut, to anywhere. So he had this. This was the functional medicine approach. This gentleman had already gone through the pathological medical approach. You don't have tumors, you don't have anything we can see, you don't have anything that we can really treat. You need counseling. I was told that I needed counseling by the very first doctor I went to. I said aye. So in case you haven't figured this out, okay, this case is me. And it just struck me when we started this series that I should do my case first, because it's so representative of everything that we see in here. It's helpful to me as a physician for sure to be able to help people, but it kind of gave me that certainty to what I do. This took years to get through this. And furthermore, there was a GI panel that showed that I had H. pylori, that I had an imbalance in bacteria called dysbiosis, and I had parasites. I had no idea that I had parasites. And I had no idea that I had H. pylori. But H. pylori is a big deal because it messes up the ability of your stomach to make hydrochloric acid, which means then you can't break down foods, you can't get your nutrients in, aside from the fact that you have a bacterial infection that they're giving you antibiotics for. And this young man, took tons of antibiotics when I was a kid. And they say now that once you take antibiotics, one exposure to it can change your microbiome forever. And then we did some specialty testing. Back then, there was a doctor named Ari Vajdani, and we were waiting desperately at this point in time. Now that you know it's me, we were waiting desperately at that time. And I was studying with a gentleman named Dr. Datis Karazian, who I give credit for the beginning of functional medicine, period. I know there are other people that were involved before then, but this is the gentleman that is the reason you've ever heard of Hashimoto's, and this gentleman, he's the reason that you've ever heard of functional medicine, in my opinion, being in it from the very beginning, as I have been. So this other Dr. Ari Vajdani developed Cyrex Labs, which is probably one of, if not the top autoimmune testing lab. I ended up being gluten sensitive and having celiac. I tested positive for celiac. Here I am. I grew up in Trenton, New Jersey, in an Italian, in a very, very, very modest Italianish immigration type of neighborhood. There was Italians and Hungarians and Czechoslovakians and so on and so forth. And but being Italian, we had a lot of pasta and bread. So I'm not sure if I was just too stressed back then, because it was a stressful situation. But I also was feeding my celiac, which I probably had from the very beginning. Because why? Because I had my surgery when I was 5 weeks old. that violated my gut. I probably had leaky gut. I probably developed celiac early on, and I would be on the toilet for days, and I would, oh my God, I would be like, why am I alive? I mean, I'm talking like 4th grade, doing things like that. So I did test positive for celiac. I tested positive for H. pylori. I tested positive for GAD antibodies. These are antibodies to your pancreas. So I do not have diabetes type 1, but these presage the ability of you to be able to develop diabetes type 1. And I drank pretty heavily in my 20s, and I was very stressed, and I didn't eat very well. So it's kind of a miracle that I don't have diabetes too. But GAD antibodies also attack your cerebellum. And if we're about anything here, we're about brain rehab, brain neuroplasticity exercise, and the cerebellum is a big deal. If you have bad cerebellum, dizziness, vertigo, balance. If you have a bad cerebellum, you can get stiff neck, stiff back, you can get blurred vision. But the cerebellum is a part of the brain that's supposed to be shutting down that nervous response, that fight-flight response. So mine wasn't very good. Okay, so this all started to draw the picture of me. We did do more autoimmune testing. I did have leaky gut. I did test for a bad blood-brain barrier, which was not a surprise from the traumatic brain injuries that I have. And in the end, we also tested me and found that I had something called lipopolysaccharides. For those of you who are more scientifically minded, you want to look those up. Those are bad buggers. Those are bad bacteria. They cause small intestinal bacterial overgrowth. Well, small intestinal bacterial overgrowth actually causes them. Okay, and they're the cell walls of bad bacteria, and when the bad bacteria break down, these cell walls go through the leaky gut and they wreak havoc. They can cause brain fog. They can cause what's called what is now coming out to be called microglial priming. What that is for some people, a portion of people who have traumatic brain injury, the immune system in their brain gets turned on to try to dampen the inflammation that's always there, that never goes away. And when the microglia, which is the immune system there, do that, they can't do their normal job, which is to keep your brain healthy, which is to keep your neuron functioning, which is to keep you being able to grow more connections between the brain cells. And this is the new science on traumatic brain injury. And these lipopolysaccharides just turn that up. They also can create autoimmunity. They can also set off Hashimoto's. They also can cause diabetes type 1 in somebody who's eating properly. So this was my clinical picture. And after years and years of being told, like, there's nothing wrong with you and all the tests are normal, and the doctor kept coming out with this, with these findings. I mean, it was so clear that it was me. We had to find out what my food sensitivities are. And I'm sensitive to, of course, gluten, sensitive to sesame, sensitive to hemp, so much for the CBD oil revolution for me, and sensitive to wheat, and so I was eating a lot of that stuff. It's so funny. I was eating a lot of sesame seed stuff, so that I would be allergic. Oh, and I was sensitive to tapioca, which is in all of those gluten-free products, for all of those of you who are gluten-free and eating all of those products. So that was kind of like me. Now, quickly, here was my diagnosis. And I'm going to go relatively quickly with this. Here was my diagnosis: celiac, Hashimoto's thyroid. I tested positive for Hashimoto's thyroiditis, celiac, Hashimoto's thyroiditis, leaky gut, food sensitivities, post-traumatic brain injury, H. pylori, dysbiosis, parasites, anemia, reactive hypoglycemia. Remember, I had low blood sugar that no matter what I do, if I eat 6 times a day, I eat protein, I do keto, I do whatever I do, it doesn't come up. I have to take supplementation to keep it up. Mild to moderate PTSD, hyperhomocystinemia, that's the inflammation. Homocystinemia is inflammation to the brain and the nervous system because you're not processing your B vitamins properly. Hypovitaminosis, my vitamin D was 6. 6. I don't know. The range is 30 to 100, and we've done a ton of things on saying even that range is low. So, and that usually means to us that the person has either chronic inflammation or an autoimmune problem. Just for those of you who have vitamin D below 30. GAD antibodies to the cerebellum and the pancreas. and TTG6 and 3 antibodies, meaning that I did have antibodies neurologically to my system, but we already knew that because I already had the antibodies to the cerebellum. Small fiber neuropathy, and the exam that was performed on me, it was determined that the small fibers in my feet were not working right. They were very sensitive, and I was starting to get peripheral neuropathy. I knew that I was, but I wasn't I wasn't really conversant with peripheral neuropathy at that point in time, and that can be caused by several of the things that I have, not just one, but several of them. Seborrheic dermatitis and eczema, which I didn't mention, that's kind of my bellwether. As long as I'm doing everything I need to do, I'm fine. If I like skip or I go off my diet or I do something like that, the eczema lets me know within like 3 days that I'm being a bad boy, and it comes out, and then I have to be good. And then high blood pressure, and I had high blood pressure. So that's how I got here. Okay, so that's how I got here. But this is like a typical case that comes into my office. And so a lot of you are saying like, well, okay, what do you do for that? What do you do for that? Now, the reason I went through all those diagnoses was not to make you feel sorry for me, okay? But was to say this is a typical patient that comes into my office. These are real diagnoses that ultimately were ferreted out once a history was taken that was relative to a chronic pain patient. Once the testing that was done, and truly there's more testing now than there was back then. This was like in the year 2000, okay? This was like 1999, 2000, 2001. So there's a lot more testing, there's a lot more understanding what the testing should be, and so there's a lot more definitive ability to be definitive in these things. But do you have to treat each and every one of those things? No. That's functional medicine, okay? So when I have people come in here and they have 2 bags of supplements or 3, and they have one thing for each one of those things, even though they've been the functional medicine practitioners, I know that maybe they haven't been the one that's advanced enough for that type of a case. So what did we do for that? So we had to find out the food sensitivities. The food sensitivities are huge. I actually was surprised I only had that few food sensitivities. But for me, the gluten one was enormous. I have people here, we take them off of gluten, they don't have any change. That doesn't necessarily mean that they don't have a gluten sensitivity. Gluten testing is, unless you're doing the Cyrex labs, the gluten testing is tenuous. Cyrex labs are not 100% in and of themselves, but they're close. But we do an allergy elimination diet here because it's very helpful in teaching the patient about a lot of different things. So we put people on an allergy elimination diet. I didn't do that. I actually did the testing, and since then, which is 18 years, 19 years ago, I figured out, kind of with elimination of what my food sensitivities are. But they're huge, because if you have food sensitivities and you don't know it and you're eating them and you're trying to do other things, then it's gonna flare up. You're gonna eat something, it's gonna flare up. Now you don't know if it flared up because that person had a food sensitivity. You don't know if it flared up because they were stressed. You don't know if it flared up because of a supplement that you gave them. So for us, using a baseline allergy elimination diet really helps us to be more specific with supplements. The reactive hypoglycemia, if you go back to some of our back to basics on functional medicine, you'll see that the basics of taking care of somebody is anemia. Remember, I have anemia, okay? Because you need proper oxygen, you need proper essential fatty acids, you need proper, you need a lack of inflammation, you need proper blood sugar. So we went after the reactive hypoglycemia. That is critical. Just getting the reactive hypoglycemia under control with diet, with eliminating sugar from my diet, but it was also eliminating food sensitivities, which also screw up your blood sugar. Having sleep apnea screws up your blood sugar. There's so many things that screw up your blood sugar. Getting that under control, that was big, because one of the first things you want to get under control, of course, is the stress response. Well, you're not going to get the stress response under control if you got reactive hypoglycemia, and every time you go high or low, you either like nod off, or you get irritable and shaky, and you get anxiety, and you get panic attacks. It's not going to working on your brain with rehab and all these other different types of things. And I don't mean to be confusing. I'm just trying to illuminate to you the multiple vicious cycles that you have to unravel here. So reactive hypoglycemia. There's a number of different herbs and botanicals that are out there for that. I'm not here to give you specifics because every individual is different. Some herbs work better for some herbs work better for others. So we use then herbs and botanicals that help that and the brain at the same time, because a lot of times if you get the brain under control, the brain controls everything. The brain controls stress responses. But without getting into that chemical pathway, you get the brain under control, and a lot of times your blood sugar will get better. I know that might sound strange, but trust me, you can look that up also on powerhealthtalk.com and our presentations on brain affects blood sugar and blood sugar affects chronic pain. And then so we did that. We of course then did the intestines, and we did the intestines at the same time that we were doing the blood sugar and I was doing the brain rehab exercise. Because remember, I was doing the brain rehab exercise before I ever even heard of functional medicine. Okay, and so basically we started doing those things. I had to get rid of the H. pylori. I had to get rid of the parasites. I had to work on the leaky gut. I have a permanent leaky gut. So and on top, I think I said I have celiac, that I tested positive for celiac. So that's permanent. That's a permanent autoimmune problem. Hashimoto's is a permanent autoimmune problem. GAD antibodies against your cerebellum is a permanent autoimmune autoimmune disease. So there were supplements I had to take to get rid of those. We were able to do it with supplements. We didn't have to, and then there are supplements that I have to take now. I have to take supplements that keep my intestines proper. My liver, probably I think I probably pounded a little too hard when I was in my 20s, maybe early 30s. I seem like I have to take some for my liver too. But main thing is you had to do what most people of you know is the 4R program. I had to get rid of the parasites. I don't necessarily take probiotics. The new data is going more towards short-chain fatty acids, but the point is that I take these things now because my intestinal issue is not going away. It's permanent. Okay, so where a significant portion of people wouldn't have to do that throughout their whole life, I kind of tend to have to do that. The biggest thing for me, so the biggest thing for me was, though, after going through all this, and the reason we're doing these presentations is because there's a lot of new data coming out there, and there's a lot of people doing functional medicine. A lot of people think that they've been to a functional medicine practitioner and it hasn't worked for them. So I'm trying to let people know there is a level of functional medicine that works for these things in the properly qualified patient. And so today, my diet is actually a form of like the autoimmune paleo diet combined with the ketogenic diet. I do ketogenic diet and I do intermittent fasting. I do that because we are now coming to understand how involved the brain trauma is in these cases, and without a doubt, it is involved in my case. Because for years and years and years and years, we did these. I did all the protocols. I've gone to all the classes. I've stayed on top of it. I've seen thousands and thousands of patients. I've had the opportunity to really observe what's going on. And yet, new data has come out over the last couple of years about brain, how to go about it, how to heal your blood-brain barrier. And I actually do believe mine is healed at this point in time, and how much better that has gone, and how healing my brain has helped my gut, it's helped my blood sugar, it's helped my sleep. So the ketogenic diet is now the diet that is being pushed. It started not with Atkins, okay, which is a variation of it. It started with seizures and epilepsy, for those of you who are familiar with ketogenic diets. And then, of course, Atkins did it for weight loss. And I know a lot of people think Atkins was nutty, but if you look at the science, the guy was ahead of his time. But is it for everybody? I don't know. I can't answer that question yet. I try to answer questions based on what I observe. But they're now saying use it for Parkinson's, Alzheimer's. They're saying to use it, but they're saying to use it for traumatic brain injury. And I've had two. I didn't even mention the fact that I had a car accident when I was 27. My head went through a windshield, and that was another traumatic brain injury. So I had three really significant ones. And once I started utilizing the protocols that are now coming out for the brain, the rest of my physiology started to change. And now I'm actually starting to peel off and be able to peel off certain supplements from there. But that's kind of like the general thing. Sleep hygiene has helped me, keeping my room dark, and because sleep is huge, keeping my room dark, not doing my computer or whatever it is, the cell phone an hour before, not having the LED lights in the room. That's been big. Watching my metabolic capacity. Okay, so for me, I was a big exerciser. Always considered myself somewhat of an athlete, I used to love to go to the gym for hours. I can't do that anymore. Okay, there's a metabolic capacity. For those of you out there, here's what that means. You get a good day or two or three, because if you have autoimmune problems, you get those good days. And then you go out and you do all the things that you couldn't do on the days where you didn't have enough energy, and then you crash, okay? This is a big one, over-exercising. I have a patient right now who just ran her last triathlon because she understands that we're not going to be able to get her traumatic brain injury under control when she's creating massive oxidative stress and inflammation from over-exercising. But we who have these conditions don't have to go to the length of doing a triathlon. For me, if I do more than an hour of jogging, or if I do more than an hour of walking, even fast, that's a little too much. I know I walk golf courses. I've been playing this golf course now. It's pretty hilly, and I was sharing with my family the other day. I said, I think I might have to take the cart for like 9 holes or something, because if I do 18 now on a hilly course, I'm really tired the next day. So you don't get cured. You have a metabolic capacity. It's different for everybody. Mine is enough to allow me to do exercises to stay in shape. Enough to stay in shape for somebody who's about to turn 67 and just wants to be normal. So I watch that metabolic capacity, and that's my program. My program is the brain rehab exercises, knowing what my food sensitivities are, knowing exactly what diet is right for me, having a neuroplasticity exercise protocol to get the brain better. You have to exercise it. You have to get it firing properly again, the different parts of the brain. You can tell what that is by doing a neurological exam. You have to get the inflammation down. You have to get the essential fatty acids right. Now I'm taking enough essential fatty acids, which I wasn't. I was a vegetarian for a long time. For those of you who follow me, I changed, not because of spiritual or religious things or anything, but because when I tested myself, my essential fatty acids were like in the toilet, and I had been eating nuts and all those things like forever. So we need inflammation gone. We need essential fatty acids, we need sugar, we need oxygen. The anemia has to go, the blood sugar has to be stabilized. That's how you get your brain better. Okay, and then if that isn't enough, now there's nutrients that can help that. So it's fixed the brain, it was fixed the gut, all of that dampened the immune responses, and then it's been fine-tuning ever since. And you'll notice, and so I go back to my last point. My last point is I had 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19. I had 19 different diagnoses that you could actually put a code on, okay? And I didn't do 19 different things. It was brain, it was gut, it was immune, it was endocrine. It was those 4 big things, and the rest of that stuff kind of cleaned up. So that's a long case study. For those people who follow us, this is going to be advantageous because because you'll understand future case studies. I'm not going to do case studies that are this involved. The case studies I'm going to pick in the future are going to be relative to maybe polycystic ovarian syndrome, which we see a lot of, which is the #1 cause of infertility in the country. We're going to be talking about traumatic brain injury a lot, or brain issues a lot. We're going to be talking about gut. We're going to be talking about depression, anxiety, because I see it every day, all day long. We're going to be talking about low blood pressure. That's a big one. I have an amazing case on low blood pressure, which the patient has allowed me to use. So we're going to hit salient points on conditions that you're very familiar with, so that you can see, hey, some of the times it's all about the basics, and you get the basics and the blood pressure under control and the oxygen under control and all that type of stuff, and you can get significant changes. But it's different for everybody. So that's today. That's what we're going to do in the future, and we're going to continue on with our Back to Basics program, and we're going to be doing a lot this year. I took kind of about a 14-month break. I'm very excited about getting back on. I'm really, really, really interested in your feedback on anything that we have online, and so that's pretty much it. Interested in your feedback, interested in your questions. We're going to be doing questions this year, so throw them at us. I really feel like that's a helpful thing. We get a lot of good feedback on that. So until the next time I see you, whether it's our Back to Basics series, or whether it's the other 700 hours that we've done, or whether it's going to be you following this series, I'm very humbled to be able to do this. I love sharing, what I know as a patient as well as a clinician with you, and I hope you find it interesting. So until next time, Dr. Martin Rutherford, Power Health Talk.com. Anything you want to know about any of those subjects is probably on there. You can access that and then pelt me with a bunch of questions or criticisms the next time I talk to you. So, okay, till next time, take care.